Hello, Nashik. Yes, ma'am. Your first slide is visible now. Hello.
Hello.
Yes.
Hello, ma'am. Am I audible?
Yes. Yes.
Okay. Okay. Sorry for this technical issue.
Okay, ma'am. Your first slide is visible now. You can start the session.
Again, it is not a change. Yes, it's changing.
Yes.
Okay. Today's topic is a very interesting topic. HPTLC, a powerful tool for the standardization of herbal drugs. So, HPTLC is a very interesting technique, and standardization of herbal drug is as well very interesting topic. So first we will see what is standardization. Standardization means equalization of the quality through all stage of processing, like from herbal drug cultivation to the extract preparation to the finished product. So quality should be maintained throughout all the process. It is called the standardization. Now second question is why standardization is required. So as we all know, standardization is required for the quality, safety, and efficacy. So first is a consistency in the quality. So why it is required in the herbal drug? Because we all know there is no consistency in the raw material, because source are different, cultivation technique are different, harvesting techniques are different. So quality should be maintained with their chemical constituent. That's why standardization is a required. And second thing is a safety. So why safety in the herbal drug? Because we all know in the herbal drugs there are many pesticides, aflatoxins, heavy metals. So all these things should be monitored. So for this monitoring, this toxicity monitoring, standardization is required. If there is a quality and if there is a no toxicity or no any contamination, then efficacy is there. So for efficacy, quality should be maintained. And standardization is required for facilitating the scientific validation and its efficacy. If compound, if any drug or any herbal, we know it has a one effect, like it has an anti-malarial effect. So traditionally it is used for the anti-malarial, but it required the scientific validation. That's why standardization is required for proving. We are proving that component having this chemical constituent and it has a anti-malarial effect due to this constituent. So it is called the scientific validation. Now, standardization also help in the authentication and adulteration detection. Authentication means identification of the plant. Proper identification is necessary for the quality of drug, and adulteration is a major problem in today's market. So we can also identify the adulteration through the standardization process. And standardization also support the regulatory compliance. So nowadays if we want to market our drug in any, like US market or any other country, so it should be comply with that market. So for support that regulatory market or compliance with the WHO guideline, these standardization steps are required. So standardization also promote the global acceptance of the herbal medicine. If our product having a quality, if our product having a safety and efficacy, then uh, then it
Ma'am,
will.
your slide is not changing.
Yes, yes. I am on this slide only.
Okay.
If our product having a quality, then it will have a global acceptance. Now, in this standardization herbal process, how HPTLC is help and how HPTLC is more appropriate for the herbal product that we will see. So we all know So we all know in older time we are using the TLC. TLC is a very older technique. And how TLC work? TLC is work on the adsorption and partition principle. We are using the one stationary phase, one mobile phase. And if our compound is having a more affinity towards the stationary phase, then it's having a lower RF. And if compound having a more affinity towards the mobile phase, then it will run with the mobile phase. So this is the principle of normal TLC. While what is HPTLC? HPTLC principle is the same with TLC, but it is a sophisticated and automated version of TLC. So it enhances the separation efficiency as well as it enhances the uh, separation as well. It enhances the analysis. So with the TLC, qualitative analysis is possible, while with HPTLC, quantitative analysis is possible. So HPTLC having a higher resolution power and higher sensitivity than the TLC. So it is an enhanced version of TLC. Now you can see in the TLC or handmade TLC, this type of result we can get. But in HPTLC, this type of result we will get, because in TLC we are using the, for the application we are using the capillary, and that capillary we are touching with the stationary phase. That's why there is no space between the stationary phase and capillary. So stationary phase may be damaged. While in HPTLC there is a spray on technique, so they in HPTLC they just spray the sample. So there is some space between the HPTLC needle and HPTLC plate or the stationary phase. So there is no damage of the stationary phase. That's why we are getting this type of resolution in the HPTLC. So we are getting the higher resolution in HPTLC than the TLC. Now we will see the difference between the TLC and HPTLC. That TLC is, both have the planar chromatography principle of both the technique are same. HPTLC is not a different technique than the TLC. Just it is a automated technique or high performance technique. Why high performance? Because some steps run through the software. That's why it is a high performance, because we are applying the fixed volume, and it it is applied through the needle. It apply the accurate volume, and it apply through the spray on technique, and that's why it is a high performance chromatography. So there is no difference, but it is a automated technique. Now this is a full HPTLC setup. So in the HPTLC, first is a applicator through which we can apply our sample, then developer, or we can also develop in the chamber, then visualizer, scanner, that we will see one by one.
Ma'am, your first slide is visible only.
It is not changing.
No.
Why? Okay, again I will say this. Now it's changing.
Yes, now second slide we can see. Yes, yes. Now slides are changing.
Okay. So you can see the difference between TLC and HPTLC. In the TLC, already I had talked that this is the result of TLC. This is the result of HPTLC. So you can see the high resolution. There are more than 10 bands, but resolution is very higher because we apply with the spray-on technique. So this is the difference between TLC and HPTLC. This is the full setup of HPTLC. First one is a applicator, then developer, visualizer, scanner, then mass interface, and derivatizer, and software that connect all these instruments through the one PC. So we will see one by one. So this is a stepwise process of HPTLC. First is a sample application. So sample preparation is very easier than the HPLC, LCMS or GCMS, because here every time we are using the new stationary phase. If HPLC is there, then what happen? Every time we are using the same column, so we have to take care that column. But here every time we are using the fresh stationary phase. That's why no major sample preparation, just dissolve in any diluent, methanol or ethyl acetate. So just take a sample, dissolve in diluent, then sonicate it, centrifuge it, and take the supernatant or filter it. So this is a simple preparation with the HPTLC. And second stage is a stationary phase and mobile phase. So mobile phase preparation is also
म्हणजे ते
easy.
हे चालू झालं ना, वेबिनार
Mobile
होता ना
phase
आजचा.
preparation is also
हा,
easy,
आता आठवलं.
because here there is no degassing or
तुम्ही
filtration
गेला
preparation
जॉईन
like
करा.
HPLC. Just mix the solvent. You can use the mobile
ग्रुपवर
phase.
टाकली ना त्यांनी लिंक
And
त्यांच्या.
second thing is, any of the solvent we can use as a mobile phase. Just they should be miscible with each other. So according to the polarity, we can choose any of the solvent. There is no limit in the mobile phase selection. Just one thing should be there. It should be miscible with each other. Then stationary phase, there are different type of stationary phase available in the market. Commonly we are using the silica gel 60 F254. This is the common plate. People's 80 or 90% analysis are done by this type of plate. But nowadays reverse phase plate are also available in the market. And in the market two type of plate are available. One is glass coated and aluminum coated plate. And different size also available in the market: 10 by 10, 20 by 10, 5 by 10. And after the selection of mobile phase and stationary phase, next step is the application of the sample. So for the application of sample, there are semi-automatic application as well as the automatic application. Both are available in the market. So if you have a semi-automatic application, then you have to fill the syringe. And if there is a automatic application, then you have to fill the sample in the vials and just give the command. So they will take the sample on their own.
अच्छा काय नाही सर काउंट व्हायचं
Now, in the HPTLC, we can analyze the sample with either qualitative analysis, also for the quantitative analysis. So we can apply the sample, or we can apply the multiple sample on one plate, as well as we can also use the TLC plate for the preparative purpose. We can overspot the sample if we have a limitation of the standard, so we cannot mix the standard. At that time we are doing the overspot. First do the spot of quercetin, then do the spot of routine. It is called the overspot. This overspot technique also useful for the accuracy or the recovery method. So after applying the spot, next step is a developing. So for the developing, there are twin trough chamber are available in the market. Different size of twin trough chamber are there: 10 by 10 or 20 by 10, 20 by 20. So we can select depend on our stationary phase. An automatic developing chamber is also available in the market. We will having this automatic developing chamber. This automatic What are the benefit of this automatic developing chamber? It is a USP compliant model. So in this chamber, you can control the humidity, you can control the temperature. So, and there is a auto monitoring for the solvent front. If I have given that 80 solvent front should be 80%. So after the 80%, automatic plate will come up and it will dry. So major benefit of this is a humidity control and temperature control. So results are reproducible in this. So automatic developing chamber is beneficial for the reproducible results. Gradient development is also available in the market. So you have to just put the solvent. So they will mix the solvent, and this is same as the HPLC. So after developing the plate, next step is a visualizer. So if I develop a plate, then I visualize the plate under 254, 366 or white light. So in the visualizer, there are three lights. One is a 254 nanometer, one is 366 nanometer, and one is a white light. If your compound is visible in the 254, this is the image of 254 nanometer, this is the image of 366 nanometer, and this is the image of white light. So in the herbals, many a times what happen, compounds having a no chromophoric group, so it is not visible in 254 as well as it is not visible in the 366. At that time we have to derivatize it. So we can derivatize the plate according to the nature of compound, and then we will see under the white light. So we are able to see the different color of spot depending on the nature of compound. So these three lamps are available in this visualizer. So after the visualizer, there is a scanner. So what are the function of scanner? You have see these three spots are there. So in the scanner, these three spots convert into the peak. Spots are converted into the peak. So this scanner is useful for the quantitative purpose. How much amount of compounds are present in my sample, that we can conclude after the scanning of our plate or the scanning of our compounds. So scanner is for the quantitative purpose. So in the scanner, there is two mode, absorption and fluorescence. So you can select the mode depend on your if your compound having a fluorescence property, then you can select the fluorescence mode. Otherwise majority of the analysis are done by the absorption mode, and spectral range is 190 to 900. This is same as the UV range. So there are three lamps: deuterium, tungsten and mercury. Deuterium is for the 200 to 400, that is UV range, and tungsten is for the visible range 400 to 800 nanometer, and mercury is for the fluorescence mode. So after the scanning, you will get this type of spectra. This is a 3D image. This is a chromatogram. And in scanning, you are also able to see the spectrum. Like UV, we are taking the spectrum from 200 nanometer to 400 nanometer. So in this scanner, this facility is available. You can able to take the scanning. Now, for the HPTLC method development, first step is a literature survey. This is the important step. First, you have to do the literature survey, like which type of compound is there. Uh, what is the nature of your compound. According to the nature of your compound, you can select the mobile phase. So literature survey uh, is required before starting the method development, then solubility study of your compound, then sample preparation, selection of stationary phase, mobile phase. After that, you can optimize your mobile phase, you can optimize the concentration of sample, you can optimize the volume of mobile phase. So many optimization parameters are there. Then we can select the scanning wavelength, at which wavelength our compound will give the maximum absorbance. So it is called the lambda max. So selection of scanning parameters, then selection of derivatizing reagent if required. Means if our compound does not having any chromophoric group, at that time it is not visible under the UV light, it is not visible under the 200 to 400 or 200 to 800 nanometer. So it required the derivatizing reagent. So this, in herbal many compounds, for example terpenoids does not having any chromophoric group. If it is monoterpenoid, if it is diterpenoid of or triterpenoids or the steroidal compounds, they does not having any chromophoric group. So it will not absorb in 200 under the 200 to 800 nanometer. At that time it required some derivatizing reagent, so it react with that reagent and it develops some color. It react with that reagent and it develops some color, so that color we will able to measure. So in HPTLC, this is very beneficial step. Derivatizing is very beneficial step because it is, this derivatizing is very difficult in HPLC or another chromatographic technique. But in HPTLC it is very easier because here we can do the post derivatization. After developing the chromatogram, we can spray the plate and we are able to see the different colors, and we will also able to measure the absorbance of that colors. So derivatizing is a very beneficial step in the HPTLC as well as for the herbals. Now if my method is developed, then next step is a validation method validation. So we can validate our method as per the ICH Q2R2 guideline. According to the ICH guideline, we have to perform the linearity, range, limit of detection, limit of quantification, accuracy, precision, specificity, robustness, and system suitability test. So these are the parameters for the validation of the method. Now we will move toward the HPTLC in the herbal. How HPTLC is useful in the herbals. So in the herbal, HPTLC is useful for the fingerprinting purpose as well as for the quantitative purpose. So it is used for the qualitative purpose as well as for the quantitative purpose. So fingerprint analysis is for the qualitative purpose. So from the fingerprint analysis, we are able to analyze this drug or this extract is a pure or it is of good quality or not, but we are not able to analyze how much of chemical constituent is present in this. But this fingerprinting, but in US pharmacopoeia, British pharmacopoeia, they have given the fingerprint of some samples. So this is an example of one fingerprint study. So here it is a comparative fingerprint study was carried out for the jamun seed, papaya seed and asoka bark. First one is for the jamun seed, second one is for the papaya and third one is for the asoka bark. So first track is for the authenticated sample. That sample is of standard quality of jamun seed powder. So they have developed one method for the jamun seed powder, and they able to see the fingerprint of that jamun seed powder. So they match this fingerprint with the marketed sample. So there are different marketed sample. You are able to see the different marketed sample. So in 7 and 8 number sample, there are green bands. It is not in the original sample, and there are purple bands in the original sample, but it is not present in the 7, 8, 9, and 10 sample. So you can see that if you purchase the market powder from the market, then it may be some adulteration, or it may be from the other sources. So you can able to see the authenticity of that sample. Same way, this is a papaya seed and this is a asoka bark. If you take the 5-10 sample from the different sources, then you will able to see the different fingerprinting for all the samples. So from this we can conclude that in the market there is no authenticated samples are available. So these are the result from the Encrom labs. I had taken these results from the Encrom website. So this is another fingerprint study that we have done in our lab. So in our lab is a public testing laboratory. So we are doing the sample of any industry and we are giving the certification of public testing laboratory. So these are the result of Phytolife Science. Phytolife Science is a company. They are preparing the extract. So what they are doing, they are comparing their raw material with they are preparing the in-house extract. Also, they are comparing the extract material with the standard. So first of all, sample of amla. So this is the amla raw material. This is amla extract, and this is gallic acid standard present in the amla. So they are comparing the raw material with extract and standard. Same way, this is the neem raw material and this is the neem extract. Same way, this is the jetri mud, means glyceriza raw material, glyceriza oil, and glycerin standard. So glycerin standard is present in the raw material as well as the uh, glycerin oil. Same way, this is the sample of Karanj. So Karanj raw material, Karanj oil sample, and beta cetosterol is the reference standard, or we can say it is a marker that is present in the Karanj. So they have compared this. So fingerprinting analysis. From the fingerprinting analysis, we are able to see that our sample is a pure, or any adulteration with our sample is there or not. So we can authentify our sample with the fingerprint analysis. So this HPTLC we can also use for the quantitative purpose. So when there is a uh, we want to do the standardization of any sample, at that time fingerprinting is also useful, as well as quantification is also required. If we want to do the standardization of any raw material or the any extract, then we have to develop the method for the either 1 marker, 2 marker, 3 or 4 marker for that sample or the extract, and then we can check these markers are present in how much quantity. So this is a method from the Ingram lab. So they have done the simultaneous identification and quantification of 4 standards. Standards are the vidaferin A, vidanoside 5, vidanoside 4, and camphorol. So these are the marker present in the ashwagandha powder, or the we can say Vidania somnifera powder. So they have checked the aerial part of Vidania somnifera and root part of the Vidania somnifera. So here we are able to see that this is vidaferin A. It is present in the higher amount, present in the aerial part, while it is present in lower amount in the root part. While vidanoside 4, it is present at higher amount in aerial part and lower amount in the root part. While vidanoside 4 is not present, or there is a trace amount in the aerial part and it is present in the higher amount in root part. So this is the aerial part and this is the root part. So sometime what happened, we are purchasing the powder from the market, so they adulterated the root powder with the aerial powder. So we are able to identify that adulteration with this technique. So next example is a standardization of Sitopaladi Churna. So this standardization we had done in our lab. This is a project of our MPharm students. So they have done the standardization of Sitopaladi Churna. Sitopaladi Churna contain mainly 4 ingredients. One is main ingredient is a Vanslochan, then Pipli, Ilaichi and Dalchini. So Vanslochan is a bamboo extract, but it contains the some inorganic matter. So HPTLC is not suitable for the Vanslochan. So for the Vanslochan, we had done the ICP-MS analysis because it contained the 90% silica, 80 to 90% silica, and trace amount of other metals. So we have detected that metal with the ICP-MS, and for these 3 standardization, we have developed one method. For Pipli, marker compound is a piperine. For Dalchini, marker compound is a cinnamaldehyde, and for Elaichi or the cardamom, marker compound is a 1,8-cineol. We have selected these 3 marker compound and we have developed and validate the method for these 3 marker compound. So this is the method for these 3 marker compound. In this 3 marker compound, piperine and cinnamaldehyde are visible in 254 nanometer because their lambda max is 270 around, and then 1,8-cineol is a monoterpenoids. And as I said, monoterpenoids does not having any chromophoric group. So we have to derivatize it. So first we have scanned this plate and then same plate derivatize with the vanillin sulfuric acid, or you can also derivatize with the anisaldehyde sulfuric acid. Here we have used the vanillin sulfuric acid as a derivatizing reagent. So after the spraying, we are able to see the 1,8-cineol. So before spraying, there is no 1,8-cineol. So after spraying, we are able to see the 1,8-cineol. So these 2 peak we are able to see before derivatization. This is after derivatization. So this thing is very easily we can done in the HPTLC. So next is the standardization of IO squad. So this standardization also we had developed the method in our lab. For this, there are in IO squad there are 4 components. One is tulsi, one is ginger, pepper, nigrum, and then cinnamon. So So for these four, we have selected these four marker and we have developed the method for these four markers. So here also we are able to see the two before derivatization and two after derivatization. Piperine and cinnamic acid before derivatization, and then uh, ursolic acid and ginger on. This is the standard of ginger. This is the standard of or the marker of tulsi or osima. So two before derivatization, two after derivatization. So and we have evaluated the different sample of the IO squad. We have collected the samples from the market. So all the samples show the different amount of these four markers. So this is about the standardization of some formulation, or you can standardize the some extracts or standardize the some raw material with the marker analysis. Now, nowadays in the market, there is some undeclared component. Means in the herbals, some undeclared synthetic components are added. So here this is a method for the identification of some non-steroidal compounds and some steroids in the Ayurvedic formulations. So here they are non-steroidal compound, and we have also developed the method with these four plus some steroids like dexamethasone. So we are able to find the adulteration of this synthetic compound in the herbal formulation. So here you can observe paracetamol is present in the two sample, then ibuprofen is also present in the sample, like diclofenac. So we we have analyzed more than 25 sample, and out of that 25 samples we are able to see that majority of the sample contain the adulteration of diclofenac or the prednisolone. So these two adulteration are very prominent with the many herbal formulation, and those herbal formulation generally used as a painkiller, or people are using for the joint pains or the arthritis and rheumatoid arthritis. This is another example. We can analyze the honey sample and we can identify the sugar in the honey sample. So if there is a sucrose adulteration in the honey sample, then it is easier to identify with the TLC technique. In our lab we are also doing the analysis of some plants. For example, our students are working on the currant plant, so we are working on the currant leaves, stem bark, as well as the seed. So we have developed the method for the Karanjin standard, and we have quantified the Karanjin standard in these three part, as well as we have also isolated the Karanjin from the leaves as well as from the stem bark and seed. And we have also isolated that component with the help of HPTLC and column chromatography. So we what we have done, after the column chromatography we are getting the many fraction. So that fraction we evaluated on the HPTLC, and with the help of TLC-MS. TLC-MS is a interface. With that interface we can able to isolate, or we can able to scrape this any of the band. So we are able to scrape the particular band, and that samples and we are collecting the sample. That sample is ready for the mass, so you can directly inject into the mass. So we are able to identify the mass of that component. So if I have observed that this band is matching with the Karanjin standard. So for more confirmation, what we are doing, for more confirmation, we are taking the spectrum. If spectrum are matched, this is one is a standard spectrum and one is a sample spectrum. Spectrum are matched, then we can say this is a Karanjin, this port is of Karanjin. And for more confirmation, we can go for the mass. This is a method developed by the Encrom lab. So here they have identified the yellow color dye, sunset yellow and tartrazine, yellow and orange color dye in the different tea bag samples. So we are using the different tea sample, tea like green tea and black tea. So they added the colors. So we are able to identify this adulteration with the HPTLC technique. Same way we can also able to identify the color in the cosmetic samples. Many cosmetic are adulterated with the rhodamine dye. Rhodamine is very dangerous for us. It is an anti-cancer. So it be present in the cosmetic sample. Same way, this is the eugenol analysis in the toothpaste. So for any, and this is a curcuminoids. Curcuminoids contain the three band, curcumin 1, 2 and 3. So if sample, for example, Vico turmeric cream, if sample contain the curcumin, so you can analyze it contain the curcumin or not. So here there are different sample. So you are able to see this sample does not contain any of the or it contain only one band of curcumin, while this contain three band of curcumin. This contain less amount of curcumin. So these are the analysis from different cosmetics like face cream, bath soap, it contain the curcumin. So HPTLC is used for the standardization, as well as HPTLC we can also use for the bioactivity or bioautography. So DP antioxidant assay is very common technique with the HPTLC. That and another is a enzyme assay. So alpha amylase inhibition assay, alpha glucosidase inhibition assay, many other enzyme assay we can perform on the TLC plate, and we are able to identify the specific compound that is responsible for the inhibition activity. So we can directly identify the compound that is responsible for the any of the activity. So this HPTLC bioautography is very useful technique for in vitro assay. So we can able to identify the compound without doing the long process of column chromatography and anything. Here only we are able to identify that compound, not able to isolate that compound in the more quantity. Just we can identify with the mass. So this is a bioautography that we have done in our lab. So if you have any question regarding the qualitative or quantitative analysis of HPTLC, you can ask me.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Is there any question from the participants?
If you have any question, if you have any query, you can ask me.
Thank you, ma'am.
If you have any query, you can just put it in the chat box. Thank you, ma'am. I think there is no query from the participants.
Okay, welcome, ma'am. And
So,
thank you for giving me this opportunity.
thank you, ma'am.
Thank you, madam.
Uh,
Okay, can I leave
ma'am,
this meeting?
ma'am, please accept our certificate for your.
ಅರ್ಪಿತಾ ಪ್ರಿನ್ಸಿಪಲ್
Hello.
ಸೈನ್ ಕೊಡ್ಲಿಯೇ
Hello.
ರೆಕಾರ್ಡ್ல ನೋಟ್ இல்லடா
Yes,
சைன்
ma'am.
போடலாம்
Kindly accept
Yes, ma'am.
our certificate as a token of love. I am just sharing the screen.
Hello.
Okay. Okay, ma'am. Uh, I will
Hello.
share your. I will share you the certificate. And thank you very much for your valuable time. Thank you, ma'am. All the
Okay, thank you, madam.
participants, all the participants are requested to fill up the feedback form from the link which
Okay.
is
If you have
now
any
will be.
query or any question regarding this topic, you can ask me anytime. You can mail me. You can take the contact from the Charulata madam, and you can ask.
Yes, ma'am.
Ma'am, from where we get the feedback form?
Kindly fill up the feedback form.
मैम फीडबैक फॉर्म कहाँ से मिलेगा? अच्छा ओके
Link is put it into the chat box, ma'am.
ओके मैम HPTLC से related मैम और details मैम from where should we get मैम for for work
Which type
The
of details?
मैम like more to work on adulteration from different samples of plants from ma'am how could we get the data or how can we मतलब we don't have so much
If
knowledge about
okay, if you
HPTLC.
visit the okay, if you visit the website of Encrom Lab, they have done many analysis and they have developed the many method. So just go
मैम
through the methods so you can get the idea what you can do.
ओके मैम एनक्रोम हेलो मैम
Encrom,
एनक्रोम
हाँ,
वेबसाइट
Encrom,
वेबसाइट
Encrom Lab,
मैम
Encrom Labs के जो एच पी
ओके
टी एल सी के इंस्ट्रूमेंट बना रही है एंक्रोम लैब्स है, उनकी लैब है मुंबई
ओके
में, तो वो लोग कंटिन्यूअस न्यू न्यू मेथड डेवलप करते रहते हैं और उनकी वेबसाइट पे वो अवेलेबल रहती है.
ओके मैम थैंक यू मैम
anyone is having other queries? Okay, ma'am. There is no query.
ओके मैम, थैंक
Okay, we can
यू.
stop
ओके,
here.
थैंक यू.
Okay. Dear participants, kindly fill up the feedback form. Feedback link is given into your chat box.
नाही ना आता जॉईन केलं आधी चॅट्स नाही येते टाकते ना ग्रुपवर मॅडमला माहिती आहे ना आपण असं
हम्म। नहीं, इधर नहीं है। क्या क्या? अरे वो, तुम थोड़ा बुरा मान के, वो थोड़ा छेड़ते हैं यार, छेड़ते भी हैं, समझा करो। वो पता है, वो वीरेंद्र के साथ श्रद्धा थी, उसकी फाइनल पीएचडी प्रेजेंटेशन चल रही थी वहां पर, उन्होंने एग्जामिनर के सामने कह दिया कि तुमने जो बताया है उसके लिए 48 सबसे। वहां भी गई थी, मुंह बना गई से खड़ी हो गई थी। वो सबसे ऐसे ही बोलते हैं, थोड़ा छेड़ने वाला लहजा रखते हैं उसे। हाँ, वो ऐसे वहां भी बोले थे यार, आशीष सर आए हुए थे बाइबल लेने एग्जाम में, उनके सामने तुमने तो मैं, वाह बहुत अच्छा चल रहा है तुम्हारी। कौन?